Welcome to presentation on head and neck anatomy. It's introduction lecture. Today we are discussing about the triangles of the neck. Now the triangles of the neck is divided into two major triangles. One is called anterior triangle and another is called posterior triangle. We can also say that anterior triangle is also called anterior cervical triangle and the posterior triangle is also called posterior cervical triangle. Now this two triangle is separated by a strong muscle that is called sternocleidomastoid. This is the important muscle, please note that. I will draw the picture later. And the posterior triangle is separated by sternocleidomastoid and trapezius muscle. Now I'd like to draw the picture of the neck. It's very tough. Muscle is called, this is posterior muscle, that is called trapezius muscle in the back side, and this is called sternocleidomastoid. Now this whole blue region forming a shape of triangle that is called anterior triangle, and this one, this is also forming a triangle like this. This is called posterior triangle. Now anterior triangle is divided into four parts. It's submandibular triangle, submental triangle, carotid triangle and muscular triangle. We'll discuss later to those triangle. Now it's time for submandibular triangle. Submandibular triangle is bounded by mandible with anterior and posterior diagonal. Here we can see the picture of the neck. The blue portion that I am going to draw now, this one, is called submandibular triangle. This triangle is bounded by mandible this one is posterior digastric muscle, digastric belly, and this one is called anterior digastric belly. The submandibular triangle contains submandibular gland, lymph nodes, and the facial artery and vein. This one is important. Now we will discuss about the submental triangle, which is the second part of the anterior triangle. It is bounded by the anterior digastric belly and inferior boundary of hyoid bone, and in between them we can found this midline. We can say it's a midline. This is inferior boundary of hyoid bone and anterior belly of the digastric muscle. This special triangle contains submental lymph nodes. In the diagram, the green region which is showing, it's called submental triangle. This is hyoid bone, which is the inferior boundary, and this one is a anterior belly of digastric muscle. Now we're coming into the most important triangle, that is called carotid triangle. This triangle is covered by three boundaries, that is called digastric posterior belly, or we can say posterior belly, posterior digastric belly, sternocleidomastoid. We are familiar with both the muscle earlier, but there is another one that is called omohyoid belly. I will draw the diagram beside this. The blue region is carotid triangle. This one is carotid triangle. This one posterior belly of digastric muscle. This one is anterior omohyoid belly, and this one we all know that this one is called sternocleidomastoid. Sorry. Now the contents of this triangle, which are all are very important. This one, common carotid artery, the first one. Second one, internal and external carotid arteries. Third one, internal jugular vein. Fourth one, vagus nerve. Number 10, cranial nerve. And last one is hypoglossal nerve. Among the contents of the carotid triangle, common carotid artery, internal carotid artery, and the internal jugular vein have its clinical importance. Internal jugular vein give access to central line, and common carotid artery and internal carotid artery exposes the common and internal carotid arteries to remove atherosclerotic lesions. Surgically expose to remove atherosclerotic lesions. Now we are discussing the last part of the triangle, anterior triangle, that is called muscular triangle. Its boundaries are omohyoid superior belly, sternocleidomastoid, and the hyoid bone. We are familiar with these three words. The contents of this triangle are infrahyoid muscle, pharynx, thyroid gland, and parathyroid gland. I will draw the position of muscular triangle. Here in picture, the blue marked region, this one, is a muscular triangle. I'm using the sign. This one, the big muscle, big boy, that is sternocleidomastoid. This one is his omohyoid superior belly, and this small little one is hyoid bone. Now we are coming to the next triangle, that is called posterior triangle. We all know the position of the posterior triangle because it's in between the sternocleidomastoid. I told earlier that this is sternocleidomastoid, suppose, and this one is trapezius muscle. In between them, this is called posterior triangle. Posterior triangle. This one is sternocleidomastoid and this one is trapezius muscle. The contents of posterior triangle: this one is external jugular vein, subclavian vein, transverse cervical, suprascapular veins, subclavian artery, axillary nerves, cervical plexus, phrenic nerves, trunks of brachial plexus. Now you will ask, what is this called? The C. What is this meaning? The C represent it has clinical importance. The three contents of posterior triangle: external jugular vein, subclavian artery, and the cervical plexus have its clinical importance. We will discuss in the next slide. Now we are discussing the clinical importance of these three. First one is external jugular vein. Its location is superficial. It's a very large vein used in the pre-hospital medicine for venous access when the paramedic is unable to find another peripheral vein. It is commonly used in cardiac arrest or other situation when the patient is unresponsive due to the pain associated with the procedure. The next one is subclavian vein. It's a site access for the central line. This is very large vein, one of the other side of the body that is responsible for the draining blood from the upper extremities, allowing the blood to return to the heart. And the last one is cervical plexus. It is used in surgery to anesthetize the neck region.